Hello, this is Doris Fick with MedAdvantage Resources, and thank you for joining us for the How to Code CPT for eye and ocular adnexa surgical procedures. I'd like to begin by asking one simple question. Do you know how to use the American Medical Association CPT Professional Edition to code eye and ocular adnexa surgical procedures anatomically? Consider this. Surgeons specialize in performance of surgical procedures within an anatomical body system or organ. This is the same logic that the CPT code book is structured. Let's begin by identifying separately from the CPT coding manual the organs within the eye and ocular adnexa system. Once you have these, group the organs or eye parts in anatomical order or groupings with similar sections. Use the table of contents at the beginning of the CPT eye and ocular adnexa system as a reference point. Make sure that you've included all the parts of the eye and group those in groupings that they belong with. This table of contents is organized by the organ's anatomical order or groupings. The eye and adnexa codes begin with the first digit is a 6, and they fall within the code range of 65091, 68899. Check your table of contents and see all the different subsections within this code range. Also, refer back to the code descriptions. Each code is unique for a surgical description and assigned in anatomical grouping or order. The table of contents within the eye and ocular adnexa surgical system uses red text to identify the organ or part within the eye. The table of contents also uses blue text to identify the surgical processes. Common surgical approaches or surgical procedures are fairly consistent with each organ or anatomical part. Using the table of contents as a reference point, explore the common surgical approach or surgical processes. CPT Professional Edition Illustrated Anatomical and Procedural Review listing for surgical procedures is a quick reference point. You will find this at the beginning of the CPT coding manual. This reference provides surgical suffixes, the meaning, and also gives you an example, for instance, excision and ectomy. Variations of surgical procedures are defined within a specific code description. Confirm the code description as listed by the procedure code with the operative report or surgical narrative documentation from the surgeon. Once you've completed this with the appropriate code assignment to the documentation, confirming the work of the surgeon with that code, you need to apply any appropriate surgical modifiers as defined in Appendix A of the CPT Professional Edition. Pause the recording, reference that, Appendix A. This concludes our review of how to code CPT for eye and ocular adnexa surgical procedures. If you found this information valuable, check out our other topics on our blogs. If you're interested in trying a medical coding course, we'd like to offer you to register from the link provided on your screen. Put it in your browser. It will bring up a free HCPCS Level 2 coding course. We regularly charge $100 for this. We're offering it to you as a sample of how we train our students for coding for ICD-10, CPT, and also HCPCS. Thank you.